This is San Diego's news channel, KUSI News.
Okay, this weekend, more than 100 doctors are coming together for workshops on the latest surgical technologies. Some of the technology they will learn about is going to be using stem cell transfers for different areas of the body, such as the face, hands, you name it. Here with more is Dr. Maurice Sherman. And good morning to you.
Well, good morning.
So tell us about this research and what's happening with stem cells when it comes to cosmetic surgery.
Well, we're entering just a fantastically exciting era. We've opened the door and we're getting into it right now. And that's using, first of all, discovering that our fat contains the highest concentration of stem cells in our entire body. And of course, fat is very easily harvested with liposuction techniques we've been doing. We've been throwing away the fat for years, not realizing how valuable it is. And now we have methodologies where we can harvest the stem cells from the fat, and then if we don't use them right away, we can store them in storage facilities under liquid nitrogen, which will keep the stem cells viable for years, and then we can then call upon a certain aliquot of those stem cells to be thawed out, and we can then inject it years down the road.
That's very exciting for people. So we're talking about our own stem cells in our own body,
right,
our own fat. So if we've got it and we want to store it and we want to reuse it, it's a possibility. Why is that such a nice alternative when we're talking about anti-aging techniques? Why is using your own fat such a good thing?
Well, one of the precepts of aging is loss of volume. And you can look at all areas of the body, the face, the breasts, the buttocks, the hands. That's one of the 4 areas we normally inject fat. Stem cells added to that fat makes the fat we feel more viable. And our take rate and our results are therefore better.
Let's take a look at some results.
Okay.
Let's take a look. I think we have a picture of a face before and after. We're going to put it on the screen. Okay, so describe what we see here.
Well, this is the typical type of aging changes that we see, but particularly look at the cheek and how kind of flat and hollow it is, especially around the eye. We call it the lower eyelid cheek complex. And of course, there's some jowling and there's some sagging, so there's gravity that is also causing the effect that we see here. But in addition to that, they're secondary to the aging changes are secondary to the loss of volume. So think of a balloon that gets deflated and it tends to droop.
Okay, now the after picture. Oh my goodness.
Now she's had also some facelifting, so this is not just due to fat injection, but you can look at her cheek and you can see the rejuvenation of the cheek area. And also the temporal area, and that's secondary to fat injections.
Right now, we're using other types of injectables and let's get her face back up there. In order to plump the face and plump out lines, a lot of women are using this. But why would this actually be better than, say, some of those other products?
Well, it's your own tissue, number one, and it's permanent. Now, you're not going to preserve 100% of what we inject. You do lose a little bit of it, and that can vary a little bit person to person. But generally speaking, after 3 months, what you see is a permanent type of fixture,
well,
and it's
right
in
now,
your own tissue.
Some of these injectables, they wear off over time. They all do wear off, but this, you say, is going to be permanent.
Yes.
So is it going to be really expensive to do it?
Not any more expensive than think about using these fillers over and over again, and where this is, after a couple of years, this is either more cost effective or certainly no more expensive.
Okay, so if you're doing this for a couple of years or more, it will be cost effective for you.
Absolutely.
Wow, that is so interesting. I know we have some other pictures too. I think we have a hand or something like that. No more pictures, but there are other areas. You say a lot of people are interested in breast enhancement, augmentation, things like that. This could be effective for that as well, more natural?
Absolutely. So we refer to it as natural breast augmentation because we're using your own tissues. Now, there are some limitations. We can't do perhaps as big a augmentation as we can with implants right now, but we're getting there. And sometimes we can do multiple injections, multiple sessions, but of course to do that, we have to have the fat.
Right, so you want to keep your fat. Well, that's kind of exciting. But you can find doctors now that can actually do this for you, is that right? It's already here, we're at the doorstep of this?
Oh, absolutely. We have lots of commercial enterprises that store the fat that we send them to, and they of course train their doctors how to collect the fat and how to send it, and they usually list those doctors that are trained and can use those facilities on their websites.
Okay. So we're talking too, not in addition to cosmetic, also this is exciting for some other different areas too in health. Is it not?
Well, the stem cells can be used, and again, entering the doorstep and opening the door in those particular areas too, but they can be used in, for instance, in joint repair. because of the rejuvenative powers. And the cardiovascular doctors are finding it really fascinating what they're doing to diseased hearts by using stem cells.
So really, these stem cells from your fat, they're sort of like the maybe semi-fountain of youth, if you will.
In a way, I think that we're looking at it exactly in that area.
And here we've had it all along.
All along, and it's been under our noses, so to speak.
All right, and you're going to learn more about this, of course, at this symposium going on this weekend. Hundreds of doctors there. Where can people get more information on this process?
Well, I think that, of course, there's a lot of stuff on the internet right now about stem cells and fat augmentation of the body. We call it autologous fat grafting, AFG.
Okay.
So they could certainly Google it or look at it try and find it in the internet.
Right, and Dr. Sherman, you're a board certified
cosmetic surgeon.
Cosmetic surgeon. That's really important, isn't it?
Well, you want to look for somebody who has the proper credentials, the proper training, experience. But that's fortunately we are blessed with a lot of doctors here in San Diego that are well trained and are doing excellent type of cosmetic work.
It sounds exciting. Dr. Maurice Sherman, thank you so much. A pleasure to meet you.
Okay.
Okay.